All right, folks, it is 11 a.m. We've got 36 folks on right now. I've got an expectation we'll probably get double that in a few minutes. So we're going to wait just a moment here and we'll get rolling. For those of you that are joining now, after many requests, I think I figured out how to actually record this meeting. And so this meeting is recording. And we certainly have a lot to discuss about different things. So we will try to see how we can make the recording available for those that were not able to participate this morning. All right, as we're already at 45 folks, I will start sharing the agenda items, the things that we're going to talk about today. So certainly, first and foremost, we will be discussing the vaccine mandate. We're going to look at our COVID numbers. We're going to give an update on the electronic verification system, visit verification system, what's going on with that. Jean's going to discuss our upcoming vendor forums. We're going to talk more about special incident reporting requirements. We're going to discuss booster shots. We're going to talk about our new children's community crisis home, the first one in the state of California, and discuss a little bit about housing access services, new DDS directives. Michelle, maybe you can talk about the FMS information that we've received recently related to SDP. And then if you were one of the ADs, obviously we've had some movement with self-determination. So maybe you could give just a little update on our self-determination numbers as a regional center as well. And I think that will be about it for today. So it's 11:03 now. We've got 54 folks on, and I think it's time for us to kind of just start plowing into the agenda that we have here today. One thing I will say, I know that there's certainly going to be a lot of questions about the implementation of the vaccine mandate and questions about exceptions, possibly questions about exemptions. And one thing to remember is that though I may be the Director of Community Services at Alta California Regional Center, and we have our Director of Client Services and our Director of Clinical and Intake Services here as well with Michelle and with Camelia. But we do not work for the California Department of Public Health. None of us do. And so the things that we talk about in relation to the public health order, we can discuss some of these things with you, but when it comes down to what your responsibilities are, and even more important, what your liabilities are as a company, that's not really something that we at the regional center can give you some guidance on. So just again, to get going, I want to just do a little introduction of the community services folks that I see that are on here as well. So we have our community services manager, Gino Nessie. And I see Heather Hollingworth there, and Kelsey Rainey, and Jason Scantleberry. We're all going to wave. And then we've got Zach, my executive assistant, that's on as well. And we have our new community services specialist, which, Jean, would you mind introducing your new staff?
Sure. Where is Kate? I don't see her. Okay. Oh, I see you. Hello. Kate Tal came from service coordination to our unit on Monday, and she will be our community services specialist doing quality assurance activities, along with other duties as assigned, which will include processing of vendorizations and building relationships with our vendors so we can work together on providing quality services. And I think you'll find Kate with that perfect personality to work with you on just working as a team. So that's very exciting, and welcome, Kate.
Yeah, absolutely. Welcome, Kate. We're happy to have you.
I
So there's
see
Kate,
Adelia. I see.
and Kate will wave to you guys one more time so you know who Kate is. There she is. And
Good
then we
morning,
have
everyone.
there, very thank you. And we have Odelia that's here this morning and Dan Kilmer as well. And so again, we're going to kind of get rolling here. Dan, I'm going to ask you to, when we get to the point about the department directives, if you want to give folks an update on the extension of the that allows regional centers to process the health and safety waivers as opposed to them going to DDS. All right. So just when we get to that point, I'll have you give folks just a little update about what our process is and that we're in essence, going to be continuing it. So getting into the COVID numbers, this was, we've been providing folks information on the COVID numbers for our regional center. I believe that that we had this week, the first time since July 6th that we did not have anyone to report to DDS. We had one day this week where that occurred. Unfortunately, as of yesterday, we had 5 new clients that we had to report to DDS that had tested positive for COVID. So since July 6th, with our numbers, we have 238 positive clients and 5 deaths. We currently have 4 clients that are in the hospital right now. We have 88 DSPs that have been reported to be positive, along with 1 death. And then we have 15 Alta California Regional Center staff, along with 2 deaths that we unfortunately are reporting since July 6th, when we started seeing the increase in the COVID Delta variant in our community. I want to run through some other stuff before we get into the vaccine mandate, because I feel like otherwise we're not going to get to some of those other things. And so just want to share with folks, and I will drop the link in our chat box, but we had the grand opening of the first children's community crisis home in the state of California. And it was opened in our area. And I'm just going to share my screen real quickly and give you an idea a little bit, we'll see, of what it looks like. So are you guys seeing a slideshow of one of the coolest looking houses you've ever seen in your life that you wish you could live in?
We can see it, John.
Awesome. And again, Dan and Dee Dee and Heather are primarily the ones that are doing the development for these types of homes, and they just come out looking fantastic. And the reason why we felt like it was so important to develop a children's community crisis home in our area was historically, and our staff would remember this, we've been sending people to the Los Angeles area or out of state, or to the Bay Area, to Oakland, different places where we've had a higher level of homes. And that's unfortunate, because you don't want to separate people from their families. And so being able to have a close nearby 4-bedroom home that really and truly is home-like is something that we're very excited about. This home's owned by Brilliant Corners, which is one of the housing developer organizations that the regional center works with, and is operated by Advance Kids, and which is Michelle Wagner, and they have the Advanced Kids Children's Behavioral Services. They also have the Opportunity Acres day program. They have the adult Kala House, which is called the Kala, which is one of our community crisis homes. And then now we have the children's one that's been added as well. So again, we're really pleased with how the homes come out. I heard the open house that they did was fantastic, and I believe that we've got a client slated to move in very shortly, if they have not moved in already. So
today,
again,
actually.
Today, look at that.
Yes,
So
they're actually en route right now to pick up their client.
there you go. So anyways, just wanted to share that with you. Let me go back to, we have had a few more Alta staff that have joined. And so I saw Tracy, one of our associate client services directors, and I saw Johnny Zhang, and I saw Jennifer Bloom join us. And I do want to take a time, and I'm going to have to ask him to unmute himself, to have Hewitt introduce himself. So we've been talking with folks about the emergency coordinator position that Michelle was hiring. And so Michelle, do you want to do a quick introduction real quick, maybe? for Hewitt?
Sure. Yeah, good morning, everyone. So happy to have Hewitt Mantanari on as part of our Alta team. Those of you that were on the ILS, in the ILS forum yesterday, we were talking about disaster planning. And so Hewitt, do you want to wave since we're on screen here?
There he
There you
is.
go. He's waving, everyone. Is our new emergency response coordinator. And so he's going to help us enhance our disaster planning and preparedness. And so lots to come with him and his expertise. And so we are happy that he's on board. Thanks, John.
Absolutely. And welcome, Hewitt. Again, we are very pleased that the department decided that regional centers should have this position. And for all of you service providers, which we've got a whole lot of people on here today, again, we hope that Hewitt can serve as a resource to all of you as well, as you look at, different training opportunities for your staff. So let's get Hewitt broken into his new role and get him very familiar with all of you guys in our service system. And then we can start talking about maybe training opportunities and things like that. So again, welcome. Very pleased to have you with us, Hewitt. Michelle, you want to give just a brief, or actually the ADs have joined, so maybe you might want to have one of them do it, but just do a little update on our SDP numbers. And then if you wanted to touch on the FMS kind of situation as well.
Sure. I see Tracy on my screen. Tracy, you want to give a quick update on our SDP numbers for going into October?
Sure. Going into October, we have a total, what we call flip the switch, of 25 clients currently, participants, SDP participants now. I know of one for sure that has, the planning team has developed the IPP and is going to switch in November 1st. I'm guessing there are several more. I'm hoping. A few more.
Awesome. We went from 16 last month to 25 this month. So we're excited about that. Our numbers are going up, and I see Johnny clapping, lots of SDP action going on at our regional center. So we're really happy to present that number and the fact that it's going up. Regarding SDP and FMS, there was a question that was presented a couple of days ago regarding the mandate, and does it apply to clients that are in the self-determination program? And so yesterday, our executive director was able to get some clarification from the department, and DDS has confirmed that yes, the vaccine mandate does extend to clients that are in the self-determination program. And it's the person or entity responsible is whomever is the employer of record. So in some cases, it could be the FMS agency themselves, or in other cases, it could be the client. So we are going to be working with our clients that are in SDP as well as our FMS agencies, but wanted to share that clarity that we obtained yesterday, that clients that are in SDP, the vaccine mandate does apply to service providers. And so that's what I wanted to share. Any questions about that? No? Okay.
And then I guess I would ask the ADs, you guys have done a little hiring. And so I was wondering if you guys would share maybe who our new managers are at Alta California Regional Center.
Sure, I'll go first. So I am excited to say that we have a growth unit in our Woodland office, which there are currently 5 service coordinators who have been over. Jazz Preetman has been the manager over those 5. Jazz will be doing solely Yuba City now and have a full second unit over there. And our Woodland office CSM is now Catherine Weston.
So some of you guys know Catherine from these meetings or from other communications. She's currently our HCBS specialist at the regional center. and also completed her master's degree rather recently as well. And Catherine's got a long history of working with the regional center, not just this regional center, but the regional center as well. And so I know I'm very happy for Tracy. I'm very happy for the Woodland area because that area continues to grow. And so being able to have another manager there, hopefully we can find enough service coordinators for the managers to manage. But in the meantime, we know that there's growth that's going on out there. And then also, that also helps out Yuba City, as you just heard as well, because then that allows us to have additional growth for Jazz Man's group up in that area. So, we've got Terry Rhodes up at there. We've got Jazz full-time with 2 full staffs up there. And again, it's just our population is growing at 1,000 new clients net annually. And we have to be responsive to those areas that are honestly outside of Sacramento as well. So I'm very pleased to hear about that. And let's see, Jennifer, I saw you perk up. Let me have you go next.
Okay. Hi, everybody. I just recently hired a new client services manager to serve a children's unit here in Sacramento. This is not a growth unit, but the current manager is moving to Texas. So the vacancy is available, and Matthew Bollinger is going to be the new manager. He has been with the regional center since about 2018 and previously worked at in Alliance and several ABA agencies. He's currently an SC in Tricia Cummings' adult unit, and really excited to welcome him to the children's team. November 1st is his effective date.
Excellent. And then I will swing over to Johnny and have Johnny give his update.
Yeah, I'm excited to have a new manager for residential. So Nicole Ebbs is going to be taking on the role as a manager for the 3rd, which is a growth unit, the 3rd residential unit here at Alta. Comes with a wealth of knowledge. She's currently in our specialized services and supports unit under Andy Ponce. So working and supporting the clients with intensive needs. So yeah, prior to that, she had worked for, she was actually, she started out in our Woodland office and then transitioned over to the Harvard office. But prior to that, she had worked for one of our vendors and provided a number of supports to the staff. She was a supervisor providing support to those staff and supporting our clients. So just super excited to have her on board, starting also November 1st.
Excellent. And again, having more residential facilities, more options for our clients, we certainly need more managers and more service coordinators to help support all of those facilities. We are still advertising right now for our community services manager position. We're adding a 3rd community services manager that's going to be overseeing some of the staff that I directly supervise right now. And so we've got some candidates for that. And so we'll see, maybe mid-November-ish, we might have an update on who our new community services manager is as well. So this being said, Michelle and myself and Camelia and the rest of our executive management team have been putting together these plans on, hiring and things like that. For right now, I know we've directed you guys. I'm just going to share my screen again real quickly. We direct you guys because many times service providers are, how do we do communication back and forth, et cetera. And, who's the manager of this person? And it's tough with such a huge agency like we have, and, with obviously staff turnover like everyone else does. So on our website, you can go to the About Us section. And in there, when you go to the About Us, you'll see the staffing and organization, and then it's our organization chart. This is the chart as of September 2nd. It'll end up getting updated and probably in the next couple weeks. But for right now, just know that you can reach it here and you can see, who kind of belongs to who and who's the manager of who. But it is going to change a little bit right now, as we mentioned, because we just got 3 new managers that are going to be added to this list and kind of moving a few things around. So we will make sure that we get that updated, and just know that you can always call our main line if you ever need to try to find out who the manager of one of our service coordinators, one of our community services specialists, anything else. So I'm just going to stop sharing there. Gene Onesi, can you give an update to us on our upcoming vendor forums that we have? And because obviously there's a lot within each different subject where people will have questions and comments as well.
Sure. On October 13th, we have our behavioral services vendor forum scheduled from 1 to 3:30. On October 20th, we have our early intervention vendor forum scheduled from 1 to 3. We had a change with our environmental accessibility vendor forum. Originally, we had it scheduled for October 20th. We rescheduled that for October 27th from 1 to 2:30. And then we have our morning group, residential providers, on October 28th at 8:30 to 12:30. And that's what we have.
So we will also be sharing this information, thank you, Jean, during the Provider Advisory Committee meeting. That's going to be next Thursday. We'll have that all available for folks for when those come out. And obviously we also send out, you know, the updates to those that are signed up for people so that we have attendance by our folks. Jean and I were discussing a little bit earlier just the importance of clarifying the reporting requirements. Just a refresher for service providers as it relates to reporting, special incident reporting related to COVID-19. And so I just want to share my screen again real quickly so folks can see. And on here, you will see this is the same directive that we've been talking about since May 22nd. But this is the directive that outlines what your responsibilities are as service providers when it comes to reporting. There has not been any new updated guidance as it relates to reporting since they updated. So there was initial guidance on March 25th, and then they did updated guidance on May 22nd. And there's been nothing new specifically about SIR reporting since then. And again, the department directives, you know, they're all located on DDS's website. You can go to the coronavirus tab, as I've shared before, and the department directives, and that's going to bring up where the department directives are located. So we did have this month, or excuse me, just a few days ago, we had the extension of waivers, modifications, and directives due to COVID-19. Early start in-person services. Let's see, what else do we got here? We got directive on requirements waived, amendments to directive, day program services must be provided in accordance with local county public health orders and relevant guidelines issued by the California Department of Social Services and California Department of Public Health. Again, the guidance for all of you guys is always going to be, in essence, you need to follow the most up-to-date guidance that you receive. And, you know, you certainly can all talk to your employment attorneys that you work with or people that you consult with, but I'm going to assume that they're also going to recommend to you, as we do, that you follow the most restrictive guidance that is available to you. So, you know, if there's guidance for just general businesses, and then there's guidance for licensed day programs, and the licensed day program guidance is stricter as far as what it is requiring of you, you know, you need to be following those guidelines, not just the general guidelines that are out there for businesses. Let's see here. And trying to think if it's in this one. I think it might be. Dan, do you want to share just real quickly about the COVID health and safety waivers and you know what our process is real quickly?
Yeah. So as some of you may know, you know, applying for a health and safety waiver to DDS can be quite extensive and burdensome. So I think so in order for us to be, you know, responsive to the needs of our clients who are affected by COVID, DDS had allowed regional center executive directors to review and approve those rather than going to DDS. So that allows us to be much more responsive to getting the necessary services and supports to our clients who are affected by the pandemic. When we apply these to DDS, there's a spreadsheet, forms, and templates, things that we have to submit over to DDS. The health and safety waivers for, in this case, I just have a one-page template that I work from, and then it gets signed off by our director, Lori Bonellis. So it's a much easier process. if some of you have gone through the health and safety waiver for COVID, you know that it's we don't ask for as much information. So
Dan, real quickly, can you give us an idea approximately how many COVID-19, I think you had to report it to DDS, how many COVID-19 health and safety waivers that we've done?
about
roughly?
100, maybe a little over 100. Yeah.
Okay. And some of those are for more than one client, right? Or are they all for each client?
No, that's about 100 clients.
About 100
total.
clients?
Yeah. Yeah, some were grouped, but yeah, it was about 100 clients.
All right, thank you very much, Dan. I want to jump over to discussing, giving update on electronic visit verification. So we're talking about respite, supported living services, homemaker services, and personal attendant services. And so I got an update because they did a meeting, and Jennifer Parsons and January Crane from DDS. And with that, they talked first off that, and thank you for those of you that responded back to us, they are building the database of all the different providers amongst all the regional centers that are responsible for doing EVV. And the DDS target date to launch the electronic visit verification is January 22nd. And I'm pretty sure it's 2022 and not 2021, like it says in the notes here from the person that sat in that meeting for me. So one of the questions, or excuse me, one of the things that they shared was they're working on developing additional training materials for you as service providers. For those of you that are, required to do the EVV stuff, I do see that we will probably just host a meeting at Alta, and I would say probably in the next month or so, that is going to allow folks under those different service codes to just come in, let's all get on the same page about what the requirements are, what Alta knows so far. So if you are one of those services that was described earlier, we'll be having Olivia, our community services manager, rejoining us on Tuesday after being gone for about couple months now, and so we're very excited about that, and we will look at Jean's very excited about that as well, and we will be looking at getting the electronic visit verification meeting kind of scheduled so we can again just get on the same page, and then also for questions that you have as service providers, we want to make sure that we can be responsive to those. So that's kind of what's going on with electronic visit verification. They are looking at making training materials available both in English and Spanish, but there's going to be a mobile application for this that's going to go, I guess, on people's phones, and there's a whole lot of different languages that are going to be part of that mobile device. And other questions, for electronic visit verification, is this something that can be done, on a laptop in the home? Is it something that needs to be done on a person's, personal cell phone? So we can certainly talk about that a little bit more as we move into the next phase of electronic visit verification. All right, and we had a public health order that was released, some of you may be aware of. And that public health order is, I'm going to bring it up for folks so they can take a look at it. So this is, I would say the topic of basically most meetings that I've been participating in. And Hewitt, can you see the California Department of Public Health's website? Thumbs up? Yeah, all right, right on, perfect. So this is the California Department of Public Health's website where it describes what the COVID-19 vaccination requirement mandate is for, in essence, our service system. Again, just like what I sent out previously, I'm not going to summarize per se, because I really want to make sure that folks read all of this information. As I mentioned at the top of our hour, as I think I hit record on this meeting, was that none of our staff here are employees of the California Department of Public Health, and when it comes down to how they are going to choose to enforce this, that in essence that's the standard that you need to meet. Things that Alta says and things like that. Again, we're not California Department of Public Health, and so that is a kind of an important thing to keep in mind, and also why certainly want to take a look at your company's liability as it relates to complying or not complying with the public health order. But something to remember as well is that we're still pending OSHA information. So we're still waiting for OSHA to come out with their guidance related to employers that have more than 100 individuals as well. Some of you also work, I know, in other counties. You may be familiar with Los Angeles's counties. Most recent order that they just put in place, very, very strict / restrictive as it relates to COVID vaccination requirements to be able to, I guess, move around freely within the county of Los Angeles. So I want to just go over just again real quickly the who is included in this order, and then repeat some of the things that I talked about last week that I'm really hoping that folks are kind of taking or giving attention to. So first off, who does this apply to? Adult and senior care facilities licensed by the California Department of Social Services. So if you have an adult care home, this is going to apply to you. Community care licensing also came out with a provider information notice that indicates the responsibility of licensees to follow the public health order. There was also the directive that came out from the Department of Developmental Services as well to the regional center executive directors related to this order. Some of the specifics in the regional center one, the one that came from the Department of Developmental Services, was related to the requirements for us to post this information publicly on our website and make sure that we've communicated it with our providers. Again, looking at who all is included in this, I think I will really just kind of look at A and E right now, and E being all regional center employees as well as service provider workers who provide services to a consumer through the network of regional centers serving individuals with developmental and intellectual disabilities, except for those workers who only provide services to a recipient with whom they live or who are a member of the recipient whom they provide services. And so I don't think I'll be answering my door right now. That would be kind of interesting if I did that in the middle of this meeting, though. Just got up and answered my doorbell. Probably not. And so one thing I really want to point out is the difference between an exception and an exemption. So the exceptions are what's described right here. And the exceptions are, in essence, if you're providing services in the home and that's all you're serving, there may be an exception that can be granted. I saw Nikki on here from Enriching Lives, and I know that there is a question that's floating around amongst all the regional centers this morning about family home agencies and family home agency providers, and whether or not, if those individuals that are providing services within their own homes are required to have the vaccine as well. The guidance that we would give to the family home agencies is the same kind of that I said at the beginning of this hour, which is that we're not employees of the California Department of Public Health. We would encourage you to consult with attorneys as it relates to whether or not you feel like this can be extended to the homes. One of the things just in our thoughts is that in family home agencies, not dissimilar to foster family agencies, there's a lot of respite care that's provided where you might have an individual that's moving from home to home. I would have a hard time wrapping my head around not having to be vaccinated if you're providing respite care for someone else that's going on in the home. This is a little bit more complex, and obviously there's these little individual different service codes where there's a lot of these questions. I know many of our early intervention service providers were asking about this. We know that I would say certainly the supported living providers and ILS providers, we've heard a lot of questions specifically as it relates to this. One of the things that the guidance that I've at least received is that do not expect from DDS like specific guidance broken down by service code. That is not something that can happen. Additionally, or it's not something that is projected to happen. The other thing is that there's different interpretations of this from regional center to regional center. And so don't think per se that you can come to like me or our regional center staff and we can say, yes, you qualify for an exemption, or excuse me, yes, you qualify for an exception, or no, you don't qualify for an exception. Like, we are not going to be the determinants of that. And so we can help you. We can certainly refer you back to your own employment attorneys, but you're going to have to look at the liability that you take on related to that. This is just talking about exceptions. Exemptions are a different thing. So there's also been questions, and I'm going to just scroll down a little bit, where we talk about exemptions. So the exceptions are one thing, that's in essence related to, giving an exception for services that are provided basically in the home to one individual. But when you look at the exemptions, then you have the qualified medical reasons, and then you have the religious exemptions as well. One of the questions was asked was, can an ILS agency give an exemption to their staff? And the answer for all of you is that it is your responsibility to give out exemptions. That is, you as the employer, the owner operator of these companies. That being said, you also are responsible for the liability that's related to the accommodations that you make for your employees. And there was a spirited discussion about this yesterday during our ILS meeting. I think it was a good discussion because it's just making folks aware that there is a responsibility that's tied to this, that's related to, if you have ongoing cases of COVID, a client gets COVID, a client gets sick, hospitalized, dies of COVID, and you can trace it back to one of the staff that you provided an exemption for. In essence, kind of be prepared for the repercussions that might be related to that. And so I think what this speaks to is making sure that you guys document your processes really well. I mean, an attorney will give you this guidance. They're going to tell you to make sure that you document your process really well for your employees, and that you guys retain all of that documentation. Outside of that, there's not really a lot of legal advice per se that the regional center is interested in giving service providers related to that. But just wanted to share with folks that there should be no question that, if you're a regional center service provider, that this does apply to you. And that, if you provide those exemptions, you certainly need to keep all of the records available as it relates to that. Last week when we met, I had mentioned that, as it relates to enforcement of the public health order, and I'm just going to stop sharing my screen real quickly. When it comes to enforcing the order, we do not per se have any type of special quality assurance activities planned for December 1st. Right now, I will be honest with you, Alta's largest concern is how many of you all as service providers are going to be able to continue to serve your clients that you currently have, or possibly serve other clients if you have a loss of staff. And so real quickly, and I will just ask you guys to, since I know not everyone per se has all of their cameras on, but we've got a lot of folks on here. And so I'll ask you to just maybe give me a little bit of feedback in the chat box. One of the proposals that was made by our new client services manager for the Woodland office, Catherine Weston, was for us to reach out to you all as service providers so that we could find out who is going to be able to accept referrals on December 1st. And I don't know that many of you have those answers right this moment. I think you're, continuing to go back and forth with your employees and trying to figure out, for example, who's going to be filing for an exemption request, who's not going to be filing for an exemption request. But I also know that there's some of you that put in vaccine mandates that were earlier than this. I know we got, both STEP and Futures Explored, shared their experiences. And I know that in the case of Futures Explored, they had quite a bit of their folks that they were able to retain. So for us, we want to be able to have a list of resources that can be available to our service coordinators when we start hearing that, on December 1st, we may not be able to provide services. So the survey that we're looking at putting out, and I'll be honest with you, I'm going to be talking about this again during the Provider Advisory Committee meeting on Thursday. And then I would say we would probably put the survey out like a week or two after that. And the reason being is we don't think that right now everyone has a good handle on exactly what the impact's going to be on their agency as it relates to staffing. And so so I guess in the chat, I'm wondering if you guys would just indicate whether or not that seems like something that would not be in essence, too difficult for you to do if we were to like release it like the last week of October. And really, it's the questions would be this: it's, you know, what's the name of your company? What service code do you serve? And effective December 1st, do you foresee that you will be able to accept new referrals or not? So if we put out a survey like that towards the end of October, do you think that that would be a time where you guys would be able to answer back and give us that type of information? And so if yes, I would really appreciate it if you could put like a yes in the chat box. And if no, I'm going to call on you so you can kind of let me know why, so that we can do something different. We're trying to make this as easy as possible for folks, and also make the information that we get so much, you know, that it's something that we can do something with. I know just real quickly that, and I do see lots of comments there, that this is something that is doable for folks. And it sounds like the end of October would be a better time to conduct that assessment than like today. For those of you that are licensees of residential care facilities, and I don't, they might be doing it with day programs as well, but the Sacramento North Office of Community Care Licensing has shared with Michelle Johnson and I that they are planning on conducting a survey of everyone related to, in essence, their abilities to be able to continue serving folks, you know, with the vaccine mandate that is, you know, in effect. So we will plan on doing this, and I appreciate the comment there from Terry that there is, it's tough to be able to predict ability to hire. You know, you guys just laid it out there. 180 of you that responded back across 46 different service codes about what all of your hiring challenges and retention challenges were. And then about a week after, or 2 weeks after we got all those results tallied and shared them, now we have the vaccine mandate on top of it. And so we know that that certainly is impacting an already extremely dire situation. There may be additional surveys that are coming out.
There may already be some questions in there.
Other community partners. So for example, the community care licensing may look at doing it a little bit more widely than they're doing right now. So talking about vaccine mandates and things like that, I wonder if we can have folks possibly share what their experience is within their agency, things that are working. I know when I spoke with everyone last week, I said you guys need to be looking right now at who's going to be asking for an exemption and who's not going to be, because you need to provide enough time for your staff to still get vaccinated if you don't give them an exemption. And then also with you all, those of you that provide exemptions for your staff, you still have to decide what kind of accommodation you're going to provide to those people that you're giving exemptions to. So, you know, will they remain an employee of yours? Will you let them provide direct services? Those are all things that you have to decide. And I would encourage you with consultation with an attorney related to what your liability is as it relates to the accommodations that you make. And I hate these discussions sounding so scary and doom and gloomy and things like that, but you know, the regional center is right there with you folks. We have to do this exact same process as well. And I would just share, you know, on behalf of our executive management team, that it is extremely difficult and challenging to have this go on right now. We already, as you guys were aware, are short-staffed, and the prospect of possibly losing employees is, you know, devastating for our service system. That being said, as you guys are well aware, we're also huge proponents of vaccination. We think vaccination is going to be the key for us to get back to normal again, to be able to have all of our in-person activities that our clients value so much. So that being said, I wonder if I could open it up now for the last, you know, 15 minutes of our discussion here for folks to share maybe some of the steps that they've taken. I will say, and I hate to do this when I have when I don't have Jackie Foss from STEP on here, but there was a offer made during one of our vendor forums yesterday for possibly a group session or a group meeting with the attorneys from that work with STEP. and with the recognition that some of the smaller companies may or may not have the ability to do something like that. And so what I would be willing to do is continue to discuss that with STEP and see if they would possibly be willing to do some type of training. Some of you are aware that they've been offering trainings, you know, across our service system, making it available to providers for years. And I don't know that there's a topic more important right now for our providers to be discussing. So I think I will just let you guys know, I will share if folks are interested in having a meeting like that and a kind of a group discussion about, you know, liability exemptions, things like that, then I can engage back with the STEP folks about seeing if they want to look at hosting something. So again, one of the reasons why we do this meeting as well is, you know, this is our support group, folks. You know, we're all in it together, and the ability for you guys to be able to provide resources to each other is very valuable. So do we have folks that want to share kind of how things are going within their agency and questions, concerns that they have? No. All right. Well, if that's the case, if we don't have that, then I would be happy to answer then questions that folks might have just specifically about the public health order and even the regional center's response to that. So do we have any specific questions about the public health order that folks want to talk about or discuss? Is everyone feeling really good that on December 1st, they're going to be able to continue to serve the same amount of clients they're serving right now and be able to accept new referrals?
Hey, John, this is Phil Perez.
Hey, Phil.
Hey, I have questions. You know, I think we're kind of doing some preliminary work right now, and it's actually looking pretty good in terms of.
Phil, where do you work? What do you do? Just so people know.
Oh, okay. I'm Phil Perez, and I'm gonna turn my video on here. I've just moved offices here in my house, so it's a little embarrassed in my background, to be honest. But hey, we're all here, right? This is us.
I think Odelia has a dead plant in hers, so don't worry about it. You're okay.
Well, I can't keep anything alive.
John, it's gonna come back.
Okay.
Good to see you, Odelia. I'm Phil Perez. I'm the new executive director for Marikey in Northern California. We have some EBSH homes and opening up a crisis home up here in Northern California, some other SRFs. And so we are kind of in the early process of the early stages of kind of figuring this whole process out, right? And actually, it's actually looking pretty good. So we have some staff that we've reached out to, most of our staff, and it's looking like a lot of them are moving towards the ones who aren't vaccinated are going to get vaccinated. Of course, you know, even in relation to that question, we're saying yes, we would be able to accept referrals later on, you know, at the end of October. But again, that's dependent on whether staff follow through with getting the vaccine, right? Because you can say yes, but then we need to make sure that they follow through and get it. So I guess my question is we, you know, with EBSH homes, with crisis homes, these are some high level homes where you can't just really move someone to another home, right? It's sort of a critical situation where if we do have staff, we end up in a staffing crisis or a crunch. What's the contingency plan? Like, is a conversation happening right now with the department? Because it's not like we can just move somebody somewhere else with these homes.
Yeah, so that is one of the things that I think, again, talking about concerns that we have and readiness and things like that, looking at the ARFPs, the adult residential facilities for people with specialized healthcare needs, looking at the community crisis homes and the enhanced behavioral support homes. You know, what is the higher level of care for those homes? It's institutionalization. Those are the highest level homes in the state of California. And so if there would not be a equivalent vacancy that might be available at one of the other ones, you know, Alta just so happens to have a lot of these types of homes. Like we got in early and started developing a bunch of them. What that means, though, is that, you know, there's not necessarily a bunch of other homes that are similar out there in the state of California that have a lot of vacancies. There are a number of homes that are in process of opening right now, but the reality is that the staffing and hiring challenges and the COVID mandate issues that you all are facing are across the board, across the state of California for our service providers and across many different sectors, as well. You guys are seeing deadlines for today for like law enforcement, for fire departments, things like that, really serious public safety concerns that are tied to it as well if we have to look at, mass layoffs. So I think more than anything else, when we talk about EBSHs and CCHs, those really high levels of care, that's when it's really important, just like any of you other service providers, to be in contact with the service coordinators as soon as you think that there might be a challenge in being able to provide that support. I can certainly speak on behalf of the ADs and Michelle that they want to know as early as possible with the service coordinators. And this is one of those types of situations where I've shared it with you guys previously, that if you guys are not getting contact or responses back from service coordinators, you're going to want to elevate it to those managers. And again, you can contact our main line if you're not sure who the manager is of the clients, but we do not want to have that message get dropped in any way that there is not going to be able the type of supports. Now, this is somewhat similar to the situation, that Michelle remembers and the ADs from January when we started having DSPs just completely not being available. We had one licensee, covering 4 clients in a home, and we had COVID raging and everything else. So, we went through this a bit. And one of the things that we did was we, developed surge homes and we were able to move clients into surge homes and do some of those things when we had staffing issues tied to COVID. The challenge being is that, again, the EBSHs and the CCHs are truly the highest level of care. And so that's, again, where when you are the safety net for the state of California, which, that's what EBSHs and CCHs are, were created to be part of the safety net. If the safety net breaks, then we end up having outcomes that we don't want for our clients. So, for example, things like possibly having individuals have to spend time in a more institutional type setting. Granted, the state of California has moved away from the old institutional type settings and instead have moved more towards small kind of family homes that are operated by state of California staff. And those are what they call the STAR homes that are throughout the state of California. But again, I think, we've got Dan on here and we've got Heather on here as well. And so if we have any issues related specifically to those really, really high level homes, communication to the service coordinators, communication to the community services specialists that are responsible for those homes are very important.
Yeah, great. Thanks, John. I appreciate it. And if we get closer to that deadline and we see that we're having issues or we kind of foresee something that's going to be a problem, we'll definitely keep you guys in the loop. And then, equally, if there are other vendors out there, EBSH vendors who are in a similar situation and we need to pull together to just get stuff done and support people, like, reach out to us and we'll work together so we can all kind of support each other in that.
Yeah, and the beauty is that we do have a lot of attention that we put towards these types of homes. There's monthly meetings that go on amongst staff that work with those homes internally at the regional center, but being left without support would be very devastating. I will tell you though, and I think I said this yesterday during the ILS meeting, certainly we're very concerned about residential care facilities. I'm really, really concerned about supported living agencies. That is if I have a big worry, that's my big worry right now is supported living agencies. And so and everyone says, yep, or I see people nodding their heads. So that again, I think is where we are really looking at concerns. One of the things that has been raised is what about relief for service providers as it relates to the COVID mandate? What about covering the costs of increased testing of the of our staff, of your guys' staff? What about the increased costs for overtime costs when December 1st rolls around and you've got SLS people pulling together 2 and 3, shifts, and you've got mileage and everything else. Yeah, as you see there from Andrea from InAlliance. So I will just let you know that I've already engaged the other regional centers in some discussions about service provider relief as it relates to the COVID vaccination mandate, and continue to have some further discussions with ARCA and with the Department of Developmental Services as it relates to it as well. I foresee us being in a situation where we're going to have some providers that are going to see huge costs going up related to providing the direct services that they need to provide effective December 1st. I want to touch on, so just know that that's something that's going on. I want to touch on booster shots real quickly and just give just a little update about Alta's efforts as it relates to that. Camellia has been working with Alert Home Health, which is a service provider that is currently working out of the Valley Mountain Regional Center agency. We've engaged with them to look at developing there will be no federal pharmacy partnership program, to my understanding. Those of you residential providers that are aware of the mass vaccinations that went on in residential care facilities at the beginning of this calendar year. So as it relates to boosters, having talked to different folks, we've learned that there does not seem to be any type of coordinated effort for boosters. So we are going to make a coordinated effort for boosters. We'll be discussing this again at the Provider Advisory Committee next week, but we are going to be engaging with Alert Home Health to have them go out and provide booster shots to our clients that are living in residential care facilities. That's going to be our first step. And so with that, right now they can do the Pfizer vaccination, booster. And I also met with Safeway yesterday morning, Safeway Pharmacy folks. We're going to be holding a flu clinic at Alta and a booster shot clinic at the beginning of November. And in talking with them, it looks like we're looking at a Moderna approval by right around October 20th or so. And then right around the end of the month, also looking at an approval for ages 5 to 11 as well for vaccinations. Right now, there was a question about whether or not Alta is going to get deep into the vaccination game for 5-year-olds to 11-year-olds. The school districts are probably really going to be providing a lot of different opportunities. So we're going to see how that rolls out. We've had the relationship with the Mind Institute, and they've been willing to do kind of ongoing vaccine clinics as well through UC Davis. But again, just like with boosters and just like with anything else, let's see what happens, see what the demand is. And if we need to fill in and support vaccine clinics for 5 to 11-year-olds, we can certainly do that. Let's see. Any update from DDS on extending the telehealth deadline beyond November, specifically early intervention or at risk? Let's see. I think it just goes till November. Yeah, it just goes till November. I don't know. Jennifer, have you heard anything about that going away at all? I have not.
I have not either, John. No new news.
Okay. No new news. Well, no new news is good news. And again,
Yes.
as it relates to these alternative services and things like that, and different ways of doing this, while we're still in a COVID state of emergency, I don't see the department lifting or changing those anytime soon. I do see a lot of you talking about the cost of testing and thinking about the cost of testing and what it's going to do. If anyone has low cost testing resources that they want to share, I think that would be a great thing to bring up during the Provider Advisory Committee meeting or in this meeting next week, if folks are able to find things like that. We will also be on the lookout for different testing resources. Again, we already kind of talked to Alert Home Health about some of the things that they're able to do, but we're also huge. There's so many of you guys. I think we've told you that there's 1,200 different vendorizations that bill us every single month. And so there's a lot of folks that are going to have to do this. I will follow up with the STEP agency about the possibility of hosting that meeting for folks to get a little bit more guidance on the legal end related to these things. And with that, we're at 12 o'clock now. Lots of things going on here. We are in this together. Alta California Regional Center is closed on Monday, returning on Tuesday. As I said at the very beginning, I know you residential providers, supported living, any residential provider, you don't have 3-day weekends. You don't have those types of time off, but hope for everyone that you do have the best weekend, and looking forward to talking to folks next week. And again, we'll talk about the Private Provider Advisory Committee on Thursday, and then we'll have our coffee with community services on Friday. Take good care, folks. Thanks for participating with us today, and I will try to see what I can do about putting this recording online somewhere. Take care, folks.